This video is a simple introduction in the Gesret Method, a manual therapy in the treatment of asthma, allergies, and skin diseases, such as eczema and psoriasis. Jacques Gesret is born at the 29th of October 1941. Fundamental research of the pathologies of the immune system. D.O. honoris causa at the Academy of Osteopathy in Montreal. His works can be consulted at the National Academy of Medicine in Paris and at the National Library of Paris. What is asthma? To make it simple, asthma is a difficulty of breathing out the air which is in the lungs because the bronchi are narrowed by a spasm so that its passage becomes difficult. What are the causes of asthma? The contemporary medicine says it's a permanent inflammation of the bronchi which is the cause. However, everybody knows that an inflammation is a defensive reaction to a certain cause, and not the cause itself. Thus, the contemporary medicine is unfortunately wrong by treating the inflammation of the bronchi instead of attacking the cause of the inflammation. The asthmatic patients are doomed to take corticosteroids for the rest of their lives, without ever getting cured of their asthma. So, let's start from zero to try to understand where to find the real causes of asthma and in general the troubles of the breathing function. For this we need the approach of a high principle that rules in the world. The structure governs the function. Let's take some examples. The function of the vision is depending on the eye structure. If the vision is bad, all the specialists are examining the structure of the eye and eventually repair this structure so that the vision can restore normally. Second case, the hearing. The hearing function depends completely on the structure of the ear. If the hearing is getting less, specialists examine the structure of the ear and eventually restore it to try to get it back to its normal level. So now you understand that all the functions are determined by a structure. For example, the structure of a crane allows to lift heavy loads and replace them from one point to another. Using a bicycle to do the same work would be much more difficult. Let's continue. What is the structure that animates the breathing function? It is the whole of the ribs on which the lungs are pasted. If they lift up, the lungs will get filled with air. When they go down, the lungs get empty while the diaphragm completes the work. Now, let's pose as a question. In the cases of visual or auditive failure, all the specialists are taking care of the structure. So, why isn't anybody doing so in the case of lung difficulties? It is there where all the interest can be found of what Jacques Gesret discovered. He was the first to observe the thoracic cages of asthmatic persons, and he perceived that there exists one common point between them all: a smaller thorax at the right side in comparison with the left side. When an asthmatic person breathes, his left side will be filled more than the right side. He also realized that there existed more common points between the asthmatic patients: a short leg at the right side on which they supported more, a lower right shoulder, the head inclined to the left when laying on the back, and the axis of the lower incisors shifted to the left when the teeth are closed. Besides his observations, Jacques Gesret developed his personal techniques, soft and without danger, which allowed him to restructure the thorax of an asthmatic, including the whole of the body, to remove the false short leg and to put the entire body in its natural axis. He noticed every time that after he restructured correctly the thorax of an asthmatic patient, the disease disappeared. From then on, it's called the Gesret Method. But he also discovered, and this is of the highest importance, that from everybody who was declared to be asthmatic, at least 50% really wasn't like that. Why? Because these people presented an inspiration difficulty caused by a spasm of the pharynx, preceded by dry coughing, impossible to calm down. This in comparison with the real asthma attack, which is an exhaling difficulty because of a spasm of the bronchi. Also in these cases, medicaments for asthma are mostly not working. He called this inspiration difficulty a false asthma and found the means for curing as well. Here is a cough provoked by an irritation of a nerve due to a bad position of the cervical vertebra. This cough precedes very often a spasm of the throat with a problem of breathing in, the so-called false asthma. This is the case of Theo. His story, told by his parents, can be found at asthmareality.com. Theo got cured by the Gesret method. Listen. Jacques Gesret made his first discoveries in 1985. After that, he needed 11 years of work to refine his observations and techniques before he published his 2 books in 1996. It is at this time that he began to teach his method at physical therapists and osteopaths because they were already prepared to use soft manipulative techniques on the joints. Today he's retired and made place to a network of more than 300 specialists divided in 19 countries. The treatment principles are: restore a good equilibration of the pelvis, which means of its foundations. Restore a correct body axe, which means take away the tensions who are putting the subject in a scoliotic-like posture. Restore a perfect thoracic mobility, so that the breathing functions are perfect as well.
Tout, voilà, comme ça. Alors je regarde, et ben ça y est, c'est à la même hauteur. Il n'y a plus de problème. Alors ici, quand je touche, non, fais-toi molle, fais-toi molle. Voilà, c'est devenu tout mou. Alors on va poser le pouce sur la première côte de chaque côté et on va jauger un petit peu ce qui se passe. Fais-toi bien molle, hein, ma puce. Voilà, ça descend bien. Alors respire bien fort. Hop là, il a éjecté des deux côtés et il replonge des deux côtés. On respire encore bien fort.
Restore a natural cervical mobility so that there is no compression anymore of the nervous fibers which are provoking a spasmic cough.
Ça fait du mouillé dans la bouche quand je touche.
Oui.
Voilà, c'est tout. C'est bien. Et là, est-ce que ça fait aussi du mouillé dans la bouche?
Oui.
D'accord. Et quand je touche ici?
On va aller plus axé.
Aussi?
Oui.
D'accord. Et quand je touche comme ça? Juste comme ça?
Oui.
Voilà.
On the left picture you can see an asthmatic child before the corrections. On the right picture you can see an asthmatic child after the corrections.
Attends, oui, ça c'est effrayant ça.
Tu vois, quand on commence à regarder son gosse de cette façon, on trouve que ça pose quelques problèmes.
T'es beau quand même, hein, t'inquiète pas.
Oui, il est beau quand même, t'inquiète pas.
Observe cette zone ici et ici. Regarde ce déport qu'il y a.
Ouais, et complètement haut sur son côté gauche. Hein.
Vas-y, mets-toi bien, que tu te sentes bien droit. Voilà. Et regarde le plafond, ne regarde pas moi parce que ça tourne la tête sans ça. Comment est-il?
Ouais, beaucoup mieux positionné.
Ouais. Par le nez.
Here are some examples of skin diseases treated by the Gesret method. First, psoriasis. In this case, like in cases of diabetes, all the lesions can be found at the left side, starting with the shorter leg at the left. The lesions at the start. The lesions after 3 weeks. After 4 months, the lesions are gone, making place for a normal skin. The lesions at the start. The lesions after 3 weeks. After 4 months, the lesions are gone, making place for a normal skin. Here is an example of an eczema, cured after 2 months. Here you can see a bullous necrotizing disease of which the actual medicine didn't know a cause, nor a therapy. Picture taken at the first treatment. The lesions after 3 weeks. After 4 months, the lesions are gone, making place for a normal skin. Here you can see what Jacques Gesret motivated the most. In 1974, his son Frank died at the age of 10 because of an ultimate asthma crisis, after he had taken the wrong drug prescribed by his doctor. Thank you for watching this video. For more information, please visit our website at asthmareality.com.